Please excuse my dog. She might run. We might have to switch patients here. Alright, so I'm doing the physical assessment. And when I walk in, I'm going to do my hand hygiene. And then I'm going to ask my patient what their name is. As I'm doing that, just make sure I'm in the right room. And then I'm going to watch for any levels of consciousness, how awake they are. Obviously, my patient is falling asleep. And then I'm going to see if there's any discomfort in their facial expressions or anything like that. I'm going to watch for their appropriate responses and how they are speaking. I'm asking 4 questions, as in, what is your name? This is Nestle Lynn. They did tell me their name correctly. I want to ask you, like, where they are. They're going to respond correctly. I'm going to ask them, do you know where you're at? They're going to respond. And then I'm also going to ask them, do you know why you're here? And they will also respond all perfectly fine. So we're going to head on down to the head. Don't mind all my sweets behind there. We're going to start with the head. We're first going to, my patient's going to stay awake for a second. I'm going to check the head for any lesions or anything like that. Make sure everything is all good. Make sure the color and the hair distribution is all perfect, and it looks pretty good to me. Then I'm going to move on down to the eyes here. Oops, sorry. I'm going to check to see if the symmetry is good. I'm going to check their eye color, make sure everything is good there. I'll also check for edema while I'm there as well. Also going to check for alignment. Everything looks good. After that, I will be moving on down to the ears. Here are the ears. I'm looking for the shape, if there's any lesions, the size, and everything. Everything looks great in your ears. You have pretty ears here, a little messy. And then after that, I will go on down to the nose. And she doesn't like when I touch her nose, so I'm going to explain it to you. So I'm going to check for the shape. I'm going to check for any indigestion. Ooh. I'm going to be checking for any drainage and congestion. And my patient does not have any, it looks like. So then we'll move on down to the mouth. I'm going to first check it on the outside of the mouth, and then I'm going to have my patient ask them nicely if they can open up their mouth. And I will check for their hard and soft platelets, and check everything in there, and also check while I'm in their dental. So everything looks great there. Then I'm going to move on down to the heart and lungs. I'm first going to check for the carotid pulse, which is right here. And I'm going to pulse once. And pulse once. And then after that, I will move on down to the anterior chest. I'm going to check the chest, make sure everything looks good here. And then I'm going to check it here. And I'm going to check. You sound great. And then after that, I will be moving on down to check the anterior and posterior portions of the body. And I'm first going to start with the 6 spots on the chest. And I'm going to go 1 here, 1 here, 1 here, 1 here, 1 at the lungs. You sound beautiful. And then I will check the 8 spots on the back, but obviously my patient is not going to get up, so we will bring your in, and I will show you. Okay, thank you, Yor. And then after that, I'm going to ask my patient, have you had a cough or anything here recently? They're going to inform me they have not. And I'm going to ask them if they have had any mucus or anything, and if so, what color. They're also going to inform me that they have not had any. And then I'm also going to ask them if they had any dyspnea with any activity, and they're also going to tell me no. So then I'm also going to move on down to the abdomen area, which is right down here. She has her legs open, so I kind of have it blocked off. But yeah, so first I'm going to, well, before I even get to the abdomen, I'm totally missing a step. I'm also going to check the arms for the temperature. I'm also going to check for the brachial pulses, which is at the elbows. And then I'm also going to check for the capillary refills, which is the fingers. I'm also going to ask my patient if they can please squeeze my hand. And he did a great job by doing that. I'm also going to check for the radial pulse, which is right here. After that's when I'm going down to my abdomen. I'm also going to go ahead and check the femoral pulse while I'm right here, which is right at the hips. Perfect. Again, I'm going to check the legs for any temps as well. Just go ahead and do it while I'm down here. So then, after that, I'm going to inspect this surface. And it looks all good, no lesions, no nothing. Color looks great, doesn't look anything out of place. I am then going to check for the bowel sounds, which is all 4 quadrants. So I'm going to go left upper quadrant, right upper quadrant, left lower quadrant, right lower quadrant. Then after that, I'm going to pulse all 4 areas. Perfect. After that, I'm gonna verbalize, asking my patient if you have had any changes in your appetite here recently. Have you lost it, or have you had any weird things? They're gonna inform me they have not. And I'm also gonna ask them if when their last bowel movement is, if they can remember. They're gonna inform me that it wasn't too long ago, so they're doing good there. I'm also gonna ask them if they had any nausea or vomiting happening. They're also gonna inform me that there's nothing going on there as well. I'm also gonna ask them if they are having trouble with constipation or diarrhea. They're going to also inform me that they have not had any issues with that. We're also going to ask them if they have any urinary complaints, and they are perfectly fine. So then we're going to move down to the lower extremities. Like again, earlier I had checked the temperature for the legs just as I did for the arms. I'm then going to check the femoral pulse, and it was great. I'm also going to check for the posterior tibia, which is right go inside ankles right here. You're feeling great, Nestle. You're doing great, sweetie. And then we're gonna go to the. Oh, I'm losing my mind here. I'm gonna go to the dorsal pedis, and that is the feet. Oh, I'm sorry, dorsal pedis, I am losing it, is the knees. Right below and underneath the knees, which I really don't know how you're going to explain that with the dog, but I think you get the hint. And then I'm going to go down to I'm all goobered up doing it on my dog. Usually I'm doing it on my stuffed animal, but my dog was laying in the vase, so anyways, popliteal is right underneath the knee. And then dorsal pedis is the top of the feet. And I'm also going to check their toes. I also ask them to wiggle and whatnot. Then I'm going to come down here and I'm going to ask them to push. Push, and they're going to push. And then I'm going to put my hands on the top and they're going to tell them to flex up, and they're going to flex up, and they have great movement. You have great movement there, Nestle. After that, I'm going to have verbalized the whole assessment, showing that the patient here has great color, no issues, it seems, and they are perfectly healthy. I'm going to ask the patient what their pain is from a scale of 1 to 10, 10 being the worst, and they're going to tell me they don't have any pain at all, which is great. I'm also going to ask them if there's any immediate things they need at the moment, and they're going to inform me that there is nothing. And then after that, I'm going to perform my hand hygiene, and that is it.